And because there's a torquing aspect.
Oh.
Come on in. That was sweet.
That looks so good.
Yeah. Come on back up like that.
Wow.
Easy, right?
Wow, that was cool.
Yeah. That okay pressure in there?
Yeah.
Okay. There it is.
That was a weird one.
That was a clunk.
Wow.
Yeah, you needed that one. That was like an, yeah, go. There you go. And you get a crack sometimes.
Wow.
Cool, right?
Yeah.
Okay, so we're rolling here. Eliza flew in from Philadelphia yesterday? Today?
This morning.
Today she flew in. And she came to the office. She's been having a lot of knee and foot problems. And we went through the history and got the background. So we're going to just show how I evaluate people with knee and foot issues, and we'll figure out what the root cause of what Eliza has going on. She does have some past history of both ACL reconstructions back in high school. So she's had some past trauma there, as well as she has some bunion formations as well. But why don't you tell them like when did this start acting up again, and how is it limiting you?
So I'm pretty sure it happened in my softball game actually.
Okay.
I made a diving catch and I think I tweaked my knee a little bit.
Okay.
And so it's been in a lot of pain ever since.
So since the diving catch?
Since the diving catch,
Which is like a month ago,
Which
2 months
was,
ago?
I think, almost 2 months ago.
Okay.
At this point. And then I
And
think
it's hurt
because
every
I was
day since then?
yeah, and I think because I was babying this one, the other knee is now hurting.
Okay.
But I took off softball for like 3 weeks and that didn't help.
Okay.
I started like working out to strengthen all the muscles and like do the like everything around the knee, and hasn't really helped.
Okay.
And then my feet bunions, as a flight attendant, I'm always on my feet and I usually am in heels. So
Okay.
I switched to non-heels and they're still in pain.
Okay.
So that's why I'm here.
Okay. And so 0 to 10, how much pain are you having on a daily basis throughout your day?
If I'm not doing anything that will affect it, it doesn't hurt. But if
Okay.
I do anything really, it hurts up to like a 7 or 8, and then it'll kind of come down a little bit.
So what can you do in the office just so we have like a barometer?
So this hurts when I put it that way.
How much?
Like probably like a 7.
Yeah, that hurt, huh?
Yeah,
With
and
both
then
knees or just that one?
just that one. This one will hurt, kind of. It
Okay.
also makes some cracking
Yeah.
sounds. If I kneel down.
Do that.
Okay. This hurts. Like it hurts to go all the way back. I will
hurts.
because
Okay.
I can, but it hurts to
Yeah.
come back out of it.
And that hurt to get back up?
Yeah.
Yeah, and you look slow. Now, where did it hurt?
It kind of hurts all over, but a lot in like the back and the side area. Not so much like the kneecap.
Okay, back and side.
Yeah.
Alright, so we're going to get in the exam. I always start, so I already did her notes, and I took her blood pressure. Her blood pressure was slightly low, seated, and then when she stood up, it actually dropped. It's supposed to, in normal physiology, the systolic blood pressure is supposed to go up 14 points, and hers dropped, which is a positive Raglan sign, which is indicative of some adrenal hypofunction, which means that her ligaments, to me, aren't doing their job. So aside from helping her structurally today, I'll give her some supplements to help that, which will help her ligaments too. So let's watch you walk.
Okay.
Come hither. And then why don't you come on over here and kind of be where I would be. So if you can zoom out so she can see it. Go ahead and just walk to the end and back. Now, are you hurting when you walk?
Not when I walk straight, but if I turn anyway, I
Then
just
it does.
baby it.
Okay. I know it's hard to walk.
It's really hard to walk in that
Staring at
big.
So one of the things I notice is that you're dropping on your right side when you're walking.
Yeah.
Like you slam down on your right side.
Mm-hmm.
A little bit more than your left. It's not terrible. But you can see as you start to heel strike on the right, you fall to the right just a little bit. You also have absolutely no arm swing.
Not right now, no.
Yeah, you're not.
I did have it the other day.
Yeah.
But I also don't know if that's because I'm
your
not,
right arm swings a little bit more than
I'm
your
trying
left.
to walk normally, so I'm a little stiff.
Sure, sure. And you can also see when she's walking that her arches are collapsing,
Yeah.
which is causing her knees to jut in a little bit more. So actually both knees are doing it.
Yes.
Okay, so come on back in. So we're starting to understand what's going on. Let's have you take a seat here. Now, let me just see. Come on around this way. So whenever you have a leg issue, whether it's ankle, knee, or hip, you have to rule out low back. Okay? So if you're looking at it right here, the nerves that come out of the lumbar sacrum, right? They go down the leg here. That's the nerdy chart if you want to see it. I don't know if that will show up on the camera. But nerves from here, they go down and innervate the muscles down the leg. So if you have an issue here, it can be affecting downstream. So we got to rule it out. So we'll start here with the base. So I'm gonna rock back on each segment and figure out, is there anything that's not moving and putting pressure on those nerves? We've got to rule that out first, okay? So let's go to sacrum first. I'm gonna rock you back, let me know if it hurts or not.
It already hurts.
Yeah. Painful?
Yeah.
Yeah, and it doesn't move nice and gliding.
Ow.
Painful?
Yeah.
Okay, so we know sacrum's off. Let's go up one to L5. L5 is a lot cleaner to me. How does that feel to you?
Yeah, much better.
Less painful?
Uh-huh.
Here's L4.
It hurts a little bit.
Little tight
But
on
not
the
as
anchor edge there. And then L3 here.
That feels good to stretch though.
Okay. L2. Feel okay? Feels good to
Yeah.
me. And L1 moves okay.
Mhm.
So right now we got sacrum and L4. So when we go back to the sacrum, just to read, sacrum is worse. L5, L4, L4, or sacrum?
I think sacrum.
Sacrum?
Definitely sacrum.
Or L4. So L4 could be compensating. We'll
Yeah.
check it as we start to unpack it. Now we got to check her SI joints. The SI joints are these guys right here. And so we'll say pelvis because it's the pelvic girdle and it's where it meets the sacrum. We know her sacrum is out of whack. Liza, do you mind lifting this up?
My shirt.
Yeah, I just want to see if you have any swelling in your back. Okay, just kind of sit up straight. Yeah, so here, come on over here. You can actually see this. See her lumbars right here look really nice, L1, 2, and 3. There's no swelling here. Right here, there's a little bit of puffiness at L4. Okay, so you'll see that. L5 doesn't look as bad, but then when I go to sacrum here, see how puffy that is? That's edema. That means this has been out of whack for a little while because the body is trying to stabilize sacrum. So the brain's really smart. It's like, oh, I'll fill this with fluid and stabilize it. But when I push in there, she flinches. Does that make sense? So just looking at this, I would almost know before even palpating that she's got a major sacrum issue and maybe an L4. Depends if this goes away when I adjust this. But this is the primary. Okay? Okay, scooch forward. Feet together. So with your feet together, move your left knee in and out.
Oh.
Yeah. So come on around this side. This is what I'm looking around the other side. So move your left knee in and out. I'm looking actually for my right hand to be quiet. And it looks really quiet. So that's good. Do the right knee in and out. And I'm looking for my left thumb to be quiet, and it is. So she doesn't have a pelvis issue, it's a sacrum issue. Okay, sometimes it's pelvis, and we gotta address that. Sometimes it's sacrum, and hers is definitely sacrum. So now we have this ruled out. Let's go to her knee and ankle. Lay on your back, sweetie. It's my sister, so I can see that. Okay. Okay. Can you hike this up a little bit?
Yep, it's stretching.
Okay. Put this one here. Yeah.
Good for you.
And you can see where she's had the surgeries here. That's funny. So actually, one thing you notice is that this kneecap is okay. This one is facing more external. Okay, so if you just look at my hands, This one is more externally rotated, so her knee had some type of shearing injury where it went to the outside. We obviously know she had a diving catch in softball a couple months ago. She lives in Philly, so I haven't been able to see her until now. So let's check femur. So actually, do you mind giving me that model there? This is the right knee, okay? I'd like it to do the left knee, pretend this part is over here. But for this demonstration, this is what it looks like minus this would be over here. So her femur is, we're gonna check to see motion here. It should move both ways. It moves really good this way, terrible this way. So her femur is externally rotated. You feel that?
It hurts both
Yeah,
ways.
so her femur is here, which is gonna pull funky on the knee. Now let's check the tibia. Tibia's actually not as bad. Yeah, so she didn't have a tibia issue. She has a femur issue, which goes up into the hip, which now brings me up there. So let's check hip. External's fine, that's beautiful.
It's going nowhere.
It's not good. So it should have 45 degrees external rotation in the hip. Should have 45 degrees internal. She has about 15. Okay, you see that from that angle? Let's just check the other side. So we'll go again. So this is actually where her knee is on the right. We'll check femur first. The knee joint is the hinge joint. Fine. That's actually not bad. I'm
That
okay
one
with this.
feels fine.
Femur's okay here. So we know it's a femur issue here. Femur, no, not bad here. For her, it's the tibia on this side.
Oh.
Her tibia, and you can actually see this. Here, come on over from this angle. This is called a tibial torsion. Her tibia has actually, because I think she had some old injury, has compensated, and it's externally rotated. So hers is literally like this, okay? Because it doesn't want to go in. It will go easy out that way because it moves too much that way. It doesn't want to move it. You feel that? And she's
It's
making,
so painful.
yeah. Last thing you want to check on a knee is the fibular head and how that attaches. There's a bunch of little ligaments and muscles that hold that together. Usually when it gets knocked out of alignment, it goes posterior or back. Okay, so you come behind, that's the fibular, and you pull up. And hers is a little bit stuck. It's not the supreme issue, it's the tibia. Over here, that's not bad over here. Not so bad, right? So we got femur here, tibia, and maybe fibula. External and internal is fine on this side. See how internal is okay here?
Oh, I didn't think it looked that good.
What's that?
Let's see again.
Internal is not as good
Oh,
there.
yeah.
Okay. So, now, I kind of want to just check because she had the injury, whether her ACL is there. This is called Lockman's. It's an orthopedic test. And hers moves a lot.
I don't know if that's from surgery or not.
Yeah, so it's hard to know because she had an ACL tear along, how many years ago now? 6,
2010,
7?
9 years ago.
Okay, 9 years ago.
9 and
When you
8.
pull on the tibia, it shouldn't really move a lot. Hers is pretty lax, which is a little concerning because you don't know. But you'll never know unless you take a picture in an MRI.
Right.
But we'll see how that, we'll check that. But that moved too much for my liking, so I know she sprained it. This one's fine. This one, you can actually see I'm pulling a lot harder and it doesn't. Do you feel the difference there?
Yeah.
It actually,
Big difference.
It actually holds, whereas this one.
There's a lot of big difference.
Yeah, sorry, sweetie.
That's okay.
Yeah, that moves too much. So she definitely has some type of sprain in the ACL. And if you go behind the knee and you push in there, she's not going to do that. Okay. All right. So let's see what happens. Now, going downstream, we're going to check talus. I guess I'll do the foot model.
It's in the other room.
It's in the other room. It's actually her navicular. So her navicular is part of that arch. It's dropped here. Oh, thank you. So when you're looking at it from here, this forms the arch. Okay, that's the navicular bone. When that drops, it caves the whole foot in here, And once that caves in here, it creates internal rotation, and then the knee goes in, right? So sometimes the knee is like the middle child. It gets blamed for a lot of things, but it's an ankle issue or a
I
hip
am the
issue.
middle child.
You are.
How appropriate.
But her feet aren't like, they're not terrible.
Oh, thank you.
Yeah, they're really not. A little bit on that drop navicular is, so I'll fix that.
And my bunions have been hurt a lot.
Does it hurt going in or out there? It
No.
actually doesn't feel terrible.
It doesn't hurt when you. That one hurts more a little bit, but not really.
Yeah. We're gonna leave these alone and see when we start to correct the other things what
Okay.
happens to these.
Okay.
Okay? Okay. So, come on back up. Let's rehash.
Okay.
Face that way. So we have. So for you,
Yeah.
you have a sacrum issue
Yeah.
and an L4 issue.
Okay.
Okay? The reason that's important, come on over here, is because the nerves that come out of sacrum and L4 run down the leg and they innervate the muscles around the hip, the knee, and all the way down to the feet actually.
Yeah.
So if you have an issue here, it's going to affect downstream in some way.
That makes sense.
Okay? So we got to do that. Now, the nerves that come out of the sacrum, they pop out here. They go to intestines, large intestine. They go to the ovaries, the bladder. Any hormone issues going on like that?
It probably, yeah, with
Like-
my periods.
Okay, cool. So we know that there's some dysfunction here. And so, we can address that with supplements later, but just as far as physical, to show you the relationship between the organs and the spine,
Gotcha.
that's what's happening.
Okay.
Sound good?
Yeah.
All right.
Sounds
Let's
good.
get to work.
Okay. The best part.
Go face down. We're going to start with C. Here, come on over here. What do you see?
It looks like this one is shorter than this
Exactly, nice. So it's shorter by like a good ½ inch. Okay, so her right leg is shorter. Remember when I was watching her walk?
Mm-hmm.
We saw her crash to a side. When you bring it up, look, they're even.
Mm-hmm.
That means it's a sacrum issue. If for whatever reason, like they were uneven still on the way up, it would be more pelvis. And that confirms with what we found on the motion palpation. Now that we have multiple indicators, we know it's a true sacrum issue. Okay? Okay. So, this is gonna be sore in there.
Oh.
Yeah. So before I adjust this, because this is so inflamed and swollen, I want to work some of the muscles.
Is it really swollen?
What's that?
Is it really swollen?
Yeah. He had an injury.
I don't know.
He had a diving catch.
We won the game.
You won the game though.
Do it for the softball.
That's what matters.
And you guys came in first.
We were champions, just like
Yeah.
with a quick shout out.
In case we've forgotten.
Quick shout out to Big Bats.
Is that what your team name is?
Yeah.
Bats.
What is it?
Big Bats.
I'm gonna
Big
play some
Bats.
softball
The Dreams.
next year.
Fly down to Philly.
Do you guys play with a fence or no fence?
The fence is very far back.
Oh, okay. You have to hit a bomb. Did anyone hit a home run?
Yes, there's been people that have. A lot of my team hits a lot of home runs.
Really?
Well, there's one guy that does.
Okay. So her sacrum is like this.
Mm-hmm.
And then like this. So I'm gonna adjust it the opposite of that. So face me on this side. So why don't you come over to this side so you can see the contact.
Okay.
So this is what we could call the pretzel adjustment. So I set you up like a pretzel. Okay. So when you feel the bony prominence there, that's the pelvis. Here, let me show you on this. So you're setting her up like this. I can feel the bony part right here, and I want to be not on the pelvis, I want to be on sacrum. So I'll go a little in, I'll roll her in and adjust. Does that make sense?
Mm-hmm.
Cool. You okay in this position?
Mm-hmm.
Okay, so I got you here, you won't fall. Haven't lost anyone. And because there's a torquing aspect.
Oh.
Come on in. That was sweet.
looks so good.
Yeah. Come on back up. Neatly. Okay.
Yeah.
So, actually go face down. Let me recheck all four. Okay. So we can go back to the feet and see. Here, come on over here. What do you see?
They're even now.
Cool, right?
Yeah.
And let's make sure they stay even. And they do, which is ideal.
Yep.
So we corrected the sacrum issue. Now we can check out four. Because we found it, we weren't sure whether it was compensating. L4 is right here. Sore in there?
A little bit.
Yeah, so it's still a little bit sore.
Mhm.
Let's check it.
Oh, more on this side.
Yeah, more over here, right?
Yeah. Ow.
Yep. So it's sore when I push in there. You just hang here. I'm just checking lateral flexion here.
Okay.
She actually might need a similar adjustment. Just yeah, see how it moves way too
Whoa.
way too
Hey.
much. So her L4 is over here, and then it's also jammed. It's got a torsion. So actually face me on the same side. That's how we're gonna correct it.
Okay.
A lot of times they need it the other way, but this one she's got such a funky listing.
It's special.
It's so special. It's okay if I do skin to skin?
Yeah.
Okay. Sometimes right on L4 here. Okay. That okay pressure in there?
Yeah.
Okay. There it is.
That was a weird one.
That was a clunk.
Wow.
Yeah, you needed that one. That was like yeah, go face down. That was sweet.
Wow. Whoa.
Yeah, and that's still good. Good. So let's go back here and we'll recheck. So much better.
Oh yeah, that's nice.
So now this one should move better. Yeah, so, so it glides out nicely. And this one actually, because it was moving too much over here, it should actually go back to a more normal lateral. Yeah, see how it moves more normal now? Before it was like, it was so jammed that it was good. Good, good. Now, one other check with the pelvis is a hamstring test. Heel towards your back, push. But she has nothing. A little softer pelvic correction from Major Desjardins, sacral occipital technique. Heel towards your back, push. So that didn't help her, so I'm actually not going to put that there. I'm going to move the block here. Push. And that did help her, so I'm going to leave it there. So, and actually this one's kind of simple. You just, because her pelvis rotated, you just leave the blocks there, and as she breathes, you just kind of rock her, and it helps calm down the ligaments here. Deep breath. There it goes. Okay. So now you take them out, and then you recheck. Should be stronger. Push. Got it. Okay. Flip on your back. So now we're moving downstream. We're going to do a hip adjustment. Yeah, you haven't heard that yet.
What was that?
Yeah.
Wow.
So this is a pelvic drop piece, but I can use it for the hips. Yeah, instead of that, so you can do. So you're gonna hear that noise. Obviously not your body, but
Okay.
like that.
Wow.
Easy, right?
Wow, that was cool.
Yeah. It sounds way louder than.
Yeah. It's okay.
Good. And then this femur. Just because you've had trauma, we're gonna do softer ones here.
Okay.
So just take a deep breath in and breath out. So I'm doing a gentle, more of a mobilization, rather than thrusting on a knee that had, trauma. We're just going to guide the femur more because it's externally rotated more into internal. Breathe. And I do it on a breath out most of the time. Sometimes breath in, but good. One more. And breath out. Good. You okay with that?
Yeah. Much better.
Better?
Yeah.
Yeah, and then we got to do internal on the tibia. So come on around this way. So same thing here. Breathe in. So now I'm on the tibia rather than the femur. You okay?
She's got a case of the giggles.
Allie made me laugh.
I'm sorry.
Ooh, yeah. You okay? One more. I lied, 2 more.
Yeah, I could feel that one.
Yeah. Oh, it's really-
Still feels a little sore.
It does, and I think that's because it's the fibular head.
Yeah.
So I'm gonna do a fibular head adjustment
Okay.
because it went posterior. I'm gonna hook it from the back like this. Now, if I bring you up and do that, is that too
It's
much
okay.
on your knee, or is that okay?
No, I can handle it.
You sure?
Yeah, it might just be slower to come out of it.
There you go.
Yeah.
You okay?
This one was the worst one.
Yeah. Yeah. See now how that has the
Yeah.
bounce.
Interesting.
Better?
I think so.
Yeah. It feels good.
It feels yeah. When
It
you
actually
do that.
moves and doesn't have the pain.
Yeah.
Good. Now, let's go to the naviculars, the dropped ones that she had. You do this one face down. So with the navicular, you can actually see she has a little bit of swelling there. Do you see that? See how it's not bad, not bad, not bad? And then right here, there's
Yeah.
a patch. That's right under the navicular where her arch drops. Right there. If you ever want to find it on someone, you run your finger and you feel like a bony thing sticking out. That's called the navicular tubercle. So when you go to adjust it, you hook it and you want to bring it up because her arch is dropping, so you want to bring it that way. Okay? And then let this go. Like that. You just do a little bit of this. Bingo.
Nice.
Same thing here. There you go. And you get a crack sometimes.
Wow.
Cool, right?
Yeah.
That was nice. And you needed it more on the left.
Yeah, the left one was
Because
right.
that's where your knee issue was. Okay, Chica. Now we're going to go for a walk. And
Do you want me to pull these down and keep them up?
you can you can do whatever, actually. Whatever you feel comfortable with. So we want to say better, worse, or the same.
That's kind of weird.
Better, worse, or the same.
You ready?
Whenever you're ready. Work it.
Now, not that you're having like a ton of discomfort walking this way,
It was not.
but her arms are starting to swing again, where they were stuck before. She's not dropping to the right when she walks. And her arches are starting to hold better when she walks. What feels different to you?
I can definitely feel it in my feet.
What do you feel in the feet?
Before I could almost feel my arches touch the ground,
Yeah,
but I don't feel it as much.
great. Come on over here. Now, one of the other checks was when you did like this thing, right?
The kneeling down.
No, like when you brought it like over here.
Oh yeah,
That
like
one really
to
hurt.
stretch my.
See what it feels like.
Better, but it still hurts.
Better, but it still hurts.
Yeah.
So it was what before? It was like an 8.
It was more like a 7, 8. It's probably like a 5 now.
Okay, cool. So we went to there.
Yeah.
Now that's all the structural stuff. We can go deeper, and sometimes like when I have a normal treatment plan with people and I can see them more regularly, that will be like visit 1, and then we'll unpack the other stuff. But she's flying in from Philly, so we're gonna a little risk over treating her a little bit, so she might be more sore tomorrow. So lay your back.
Yes, sir. Do you want me to put them up again?
No, it's okay. Now we're gonna do muscles.
Okay.
Kick to the ceiling here. Good. Knee towards your nose. Good. Heel towards your back. This is hamstring. Look, nothing.
It even hurts
Her
to do
quad
it.
tested fine, and when you'll have a knee injury, they'll be like, "Oh, strengthen your quads." But for her quads were fine. Hammies were nothing.
It hurts to do it too.
Yeah, and it hurts to do that.
Yeah.
And what is a hamstring?
Like I give it up because I
Yeah,
can feel it.
and a hamstring is actually like an ACL. It does the same thing. It holds the tibia.
My
back.
ACL is my hamstring,
That's what I mean.
like physically.
But like biomechanically, that's.
Oh, yeah.
So go face down. Let me get in your hammies. You're not gonna like me.
I already
It's good.
know.
So I'm actually gonna use the hyper ice.
Ben's gonna be so proud.
So here's lateral
Oh my gosh.
hammy. That's terrible.
Oh my gosh.
Here's
oh my gosh.
inside hammy. So we gotta work on these. So now that we got her structurally working, I want to get a little deeper into the musculature to support that. Sit here and do that like the knee thing that you did.
Much better. It's down to like, I would still say a 3 if I kept going.
Okay, so we're going to 8 to a 3.
Yeah.
And it looks like better range of motion.
Yeah,
That's
yeah,
good,
yeah.
not bad. Now let's recheck some more muscles. Lay on your back. Let's recheck hammy, make sure it's strong.
How do I lift this thing up?
Heel towards your back. I will do that.
Sorry.
Yeah, and it's stronger now, which is good. And did that feel better for you?
Yeah.
Stay there. Now there's a couple medial insertions, so let this relax. This is sartorius. Heel towards your back. Yeah. Towards
I can already feel
your
it.
nose.
It
Go ahead.
hurts.
Full.
It
That's it?
hurts.
You have nothing?
It hurts.
I'm not even trying.
I know, because I'm not trying because I can feel it hurting.
Okay. So let's just check this one. Heel towards your back. See, that one's better. That one does good. This one is like, wow.
Well, I can, right when you do that motion, it hurts already.
It's got nothing.
Yeah, so
Okay.
I can
And
try it.
If you want to see it on the muscle chart, that's this muscle. Starts from the hip and wraps down and hooks into the medial knee, right? It's called pesanserine. So her medial knee has no support. Okay?
Okay. Okay.
Okay.
Okay.
Yeah. So it inserts on the tibial. Tibial.
That actually feels better than your thumb.
This feels better than my
Yeah.
thumb? Yeah, because it's not as hard.
You ass.
And so you draw it all the way back to that bony part on the hip.
Ah!
Positive squirm sign.
Oh my god.
Terrible. So nice.
Oh my god. It hurts more down there. This feels fine.
That's starting to release.
Yeah, that feels fine. Yeah.
It's not as squirmy. So this is the insertion. Yeah. Positive. Yeah, and you'll actually have 3 muscles insert here. Sartorius. Here, I'll show you. And the gracilis. And medial hamstring. Will actually all insert here. And actually, she's got a little bit of puffiness there.
Yeah, I do. I have swelling.
Yeah. This is also right just below the medial meniscus where these muscles enter. So if you have these muscles not firing, you'll feel like you have a medial meniscus issue, and it may not be a true meniscus issue. And it may, but yeah, fun fact of the day for you.
This
Hanging in there.
Yep.
It's pretty rough, isn't it?
Yep.
Yeah. You got this pretty good.
I know. Had to come to the best doctor I know.
Did you end up getting the MRI?
No, I was waiting to see you first.
Okay.
But it's on my mind.
Okay.
Especially after you did the ACL
The
thing and
ligaments.
it was little.
Yeah.
I know they're originally loose because of surgery,
Right.
but it felt like that was extra loose compared to this one, and that this one also had surgery.
Right.
But whatever you think I should do.
We'll check it at the end.
Okay. Because I'm an adult, I have medical insurance.
And that's still better in there?
Yeah.
Good. This is starting to loosen here.
I haven't noticed.
It's rough.
It's really painful.
I know. You okay? I'm sure that we could almost like... Okay, cool. So now that we finished those, now we can go back to the sacrum, and I just like to check after I make the adjustments and at the end of the treatment. Notice how much better that is. Any pain there?
No.
Yeah, and
Not
that
yet,
hurt
actually.
before. What's that?
That was good.
Yeah, and then here's L4. Yeah, see how much better that is?
Yeah.
So much better. Sacrum. Remember that was really tender?
Yep. It was really
Good. Lay on your back. The last thing that I wanted to check was the orthopedic test. So we had checked, remember the external rotated femur? No pain, right?
Nope.
Now, and the internally rotated tibia. Okay, so those are fine. We cleared those, we cleared the spine, we cleared the hip. I already checked this stuff. See how much better it is?
Mm-hmm.
But the thing that I really want to know is how much of this is a true ACL injury with that Lockman's test, which is the orthopedic test, the standard that they use. And that still moves too much for what I would want. Yeah, see how that one
I can
holds in
feel
there?
that one.
So she definitely sustained an ACL, and I just threw everything at this. We did muscle work, we did spine work, we did extremity work, we did feet, knees, hips, low back, everything, and it's better. Like, why don't you try it? Do the knee thing. It was an 8 before. What's
yeah,
that?
it's better. I mean, it sounds like a 3 probably.
It's down to 3. So we went from 8 to a 3 in one visit, which is still awesome, by the way.
Yeah, yeah, yeah.
But it's still shaky. So at this point, I would almost recommend that she gets an MRI because she failed the orthopedic test. So that's what I would recommend going forward. If she wasn't going back to Philly, I would see her again, and then we could recheck L4 and sacrum and continue our project here. But because she's just flying in and we're just doing an intensive kind of healing immersion, I threw everything I could at it and went from an 8 to a 3, which is awesome. But I do think that she actually may have injured the ACL, and it's hard to know unless you get a picture of it. So, sorry. You know.
X-ray.
You know.
No MRI.
MRI.
Yeah, it's an MRI. Okay. But
Really great narration.
yeah.
I feel like it kind of like ended on a sad note there.
So, yeah.
This is like the hard part of treating people, because sometimes you have to be like really real with them. And you're like,
yeah.
like it's not just all rainbows.
Well, it's not
and
gonna get
roses.
better in one visit. That's the thing.
Well, we got it better in one visit, which is good, because
But I
usually
mean,
if I
no.
can make a change in one visit, I know I can get the body to help
Oh,
you
yeah,
heal
yeah,
it.
yeah.
But with that, it's hard to know whether or not that actually truly is an ACL tear, or whether it's just been really sprained and it's lax right now.
Oh, and my feet are good.
What's that?
My feet.
Feel what?
They don't like drop.
Yeah, they look much better. Good.
Really good tan line.
Great.
Okay.
Look at that.